now we have had mainly an international perspective, but with Lina coming up with a Swedish perspective. Now we will concentrate a little more on the Swedish perspective. And first is Tomas Nilsson, who is an assessor at the Medical Products Agency, Läkemedelsverket. And you will present your work on this topic.
Thank you very much. I think you can hear me. First of all, I want to thank you for the invitation to speak here. My name is Tomas Nilsson, and I'm working for the Medical Product Agency, among other things, with illegal medicines. And I will not only talk about what we do, but I will talk about the title, How to Stop Illegal Medicines. Because as I think many of you now thinking, we have heard about the huge global problem that this problem constitutes. Is there anything we can do about it? What can we do? I think the answer to the question is yes, we can do a lot of things in this area. And that's what I will talk about. We had some discussion here what we're going to call these products and so on. I will talk quite a lot about illegal products, not only falsified, but products sold with a criminal intention. And I call them illegal because not all of them are falsified, but they are illegal to sell. The thing is that are we going to do something about illegal medicines? We have to do a lot of different things simultaneously. I think you have realized by now that this is not a problem that Sweden can solve by ourselves. And the illegal business of medicines are international. So we have to set up an international framework where actually we are setting up the rules. We know that the ones selling illegal medicines will try to cheat. They will try to take advantage of the system that we are putting up. So this is what I will talk about. I will talk about this playing field, these rules, and also what we are doing at the Medical Product Agency within these areas. Because, as I said, we have to do a lot of things. A lot of work has already been done internationally within this area. We have heard some from the World Health Organizations, and how a good strategy is described varies some between different organizations, but they can basically be summarized within these categories of these areas. I will just briefly take you through them, and I will come back to what we actually do within these areas. First, we have the regulatory framework that we have heard some about today. Almost all steps in the distribution chain of legal medicines are governed by very strict rules, a lot of checkpoints. Everything from manufacturing to package distribution, and pharmacies are under strict control. But the criminals will also try to take advantage of the weakest parts of these systems. Legislatives, as we have talked about, if you're risking 1 year in prison for selling illegal medicines or 10 years for selling narcotics, that is a factor that we have seen change the market. Communication. We have to suppress the demand. A lot of people don't even know that they are buying illegal medicines. If they would know, they would not buy. Enforcement, just to be clear about this, the Medical Product Agency do not do enforcement, but as we have heard, customs and the police are of course vital parts of any work against illegal medicines or any illegal act, and we have to work together, and there we are, cooperations. And actually we have to do all of these things to be successful. Because if we close one of these doors, we have realized that the criminals will break up another door, crime finds a way, we have to deal with that. But the last decade, a lot of work has been done within this area, and at least in Europe, this has led to a strategy based on 2 important documents that I will talk a little bit more about. First, we have the Falsified Medicine Directive. It was decided in 2011, and as the EU directive, Sweden has to follow this. It has not fully been implemented yet, but there are still activities that we are working with. Secondly, we have what is called the Medicrime Convention from the Council of Europe. This is also open for non-members of the Council, and so far 26 countries have signed and 8 countries have ratified this convention. For example, Belgium, Spain, Ukraine, France is also on the way to ratify. Sweden has neither signed nor ratified, but the official intention of the Swedish government is that we are going to sign and going to ratify this convention. Sometimes there's a confusion that a country could choose between these 2, but they are complementary. The directive aiming more for regulatory and the convention more for legislative. They both handle both communication and cooperations, but with a slightly different scope. And the Medical Product Agency is working with both these documents, with activities according to both these. For example, safety features. Every single package of medicines or prescriptions are going to have a unique barcode. So the package can be tracked and identified all the way from manufacturing to the patient, making falsification much more difficult. The Medical Product Agency also have a 24/7 emergency system where companies can notify us with information about suspected falsified medicines. We also have the authority to withdraw products from the Swedish market if we find it necessary, but usually the companies themselves withdraw the products from the market. Last year we had 5 such cases with companies recalling products from the market connected with suspected falsified medicines. Then communications. Within Europe, since last summer, there's a common logo that has to be used on any website selling medicines online. If you click on the logo, you will come to the website of the competent national authority and a list of all websites that are allowed to sell medicines online. So basically, no logo, not legal. Unfortunately, too few people know about this logo, so quite a lot has to be done still, communication-wise. When it comes to the activity according to the Medicrime Convention, as you can see, the convention is having quite a broad strategy. For example, all intentional handling of illegal medicines has to be criminalized, and also the penalty for it has to be in proportion to the severity of the crime. We had questions here if we're not going to change the legislation in Sweden. Actually, the proposal for new laws according to the Medicrime Convention suggests 6 years for severe selling of illegal medicines. So hopefully we will have change of Swedish legislations in a couple of years. This convention also talks about that the police and customs need to have tools and they need to have resources to investigate these crimes. And that is, of course, important that we have had Lina talk here today. As we have heard quite a lot about, there has to be a high level of regulatory framework, communications to the public, and also, again and again, we have to do this together. We need to cooperate. And it's mostly the last point here that the Medical Product Agency are presently working with. The Council of Europe, for cooperation according to this convention, has proposed a model based on single point of contacts. This model is also used by the World Health Organization and also, for example, Working Group of Enforcement Officers within the EU. It is based on that every country have one contact point, and then other competent authorities are going with information and cooperation through this single point of contact. Since a lot of these investigations involve several countries, then the national SPOCs can share information and they could coordinate this work. In Sweden, it has been suggested that the national SPOC will be on the Medical Product Agency, and therefore we have now, together with the police and custom, have started a project to establish a national center against illegal medicines to be this national SPOC. We're just in the beginning of this work, and we are in the process of deciding a project plan. Hopefully, this center will be established late next year. I happen to be the project leader for this project, so if you have any questions about it, please contact me. So what else does the Medical Product Agency do against illegal medicines? Also, our strategy corresponds to the international ones. So communications to the public is of major importance. Besides communication about the common logo, we also try to spread a message how to safely buy medicines online. There is nothing wrong with buying medicines online, but you need to know how to buy medicines, the legal medicines, online. We also try to pinpoint specific target groups and try to reach their arenas. Prevention is a good strategy to try to prevent illegal medicine from even entering the Swedish market. Here we're working a lot with customs. For example, we have education for personnel of customs about the legal framework for medicines. We also have other cooperations, for example, with the laboratory. And we were talking quite a lot about the legal framework. Also here, when it comes to prevention, there is things to be done legal-wise. For example, today, customs are not allowed to stop illegal medicines coming from another EU country. If it's not narcotics, customs are not allowed to stop it. Both we and customs have asked the government to take a second look at this, because we find a problem here. So, on top of all this, the Medical Product Agency is also a supervisory agency. We do not do enforcement, but we do have the authority to prohibit persons or companies selling illegal medicines. Last year we had 55 such cases, leading to 75 products were taken off the market. These were not, we have no idea if they were falsified, but they were not authorized to be sold in Sweden. We also have cooperation with the police. We had a question about internet sites. Last year we reported 66 websites to either police or the Interpol for them to further investigate them or to shut them down. So, conclusively, I do think that there are good strategies against illegal medicines, but we actually have to do a lot of things in parallel, and I think most importantly, we have to do things together. Thank you very much for listening.
Thank you very much, Tomas. When you talked about communication, I was convinced that you would brag about your campaign some 5 years ago. which was Crime Medicine, I think it was called. A fantastic, I don't know if you remember that, but that was a fantastic fake campaign on fake medicines, where you attracted people who wanted to buy falsified medicines. And it caused, you reached evidently the target group. A very vivid discussion in social media. Is this ethically correct by a governmental agency to cheat people into this? But have you seen any results? Or have you evaluated that campaign, and why are you not pursuing that line?
Actually, we had a lot of, it was quite a successful campaign then. We actually have follow-ups of it, and realized that this was quite short term. Nowadays, people don't really, they not really thinking the way that we thought they were going to think about this campaign. Then everybody was thinking about it, but now, unfortunately, people remember very quickly. But we are still thinking about, at least when it comes to the Medicrime Convention, it talks quite a lot about the necessity with big campaigns to the public, so they actually are aware of this.
Yeah. I think a common lesson for all these kind of campaigns are that they can't be short-lived. There must be booster campaigns going on all the time, it seems.
Yes.
I think we have time for one or two questions from the audience to Tomas. We heard earlier this is along the same line, earlier this afternoon of evidence-based policy. Of all these actions, what is evidence-based? Where you really have followed, you were talking about evidence-based policy. What is evidence-based? I think we can take that up in the discussion later, but this is a bit tricky.
Yes, it's a good question. You have to know what you actually are doing also. When you look at how the world looks and so on, if you come into the regulatory framework, I don't think it's a coincidence why we have quite few falsified products on pharmacies in Sweden and quite a lot in other countries. There it comes to regulatory framework. I think that is quite a major part of this strategy.
Very good. Thank you so much.